6 Basic First Aid Training Tips. 1. The 3 Ps. The 3 Ps are the primary goals of first aid. They are: preserve life, prevent further injury, promote recovery. These goals might seem overly simple, but they're simple on purpose. When someone is injured, it's all too easy to panic and forget what you need to do to provide assistance. The 3 Ps remind you of the very basics: do what you can to save the person's life, do what you can to keep them from sustaining further injuries, do what you can to help them heal. 2. Treating cuts and scrapes. Blood is a vital component of our bodies. When someone is bleeding, you want to prevent as much blood from leaving their body as possible. Try and find a clean cloth or bandage. Then, apply gentle pressure for 20 to 30 minutes. Clean the wound by gently running over it. Avoid using soap on an open wound. Apply antibiotic to the wound, like Neosporin. Cover the wound with a bandage. If someone has a nosebleed, have the person lean forward. Press a cloth against the nostrils until the blood flow stops. The body is usually very quick at patching up small cuts and scrapes. But deeper wounds may require medical attention. With deep wounds, apply pressure. Don't apply ointments. Cover the area with loose cloth to prevent contaminants from infecting the wound. Seek medical attention as soon as possible. 3. Treating heat exhaustion. Heat exhaustion occurs due to prolonged exposure to high temperatures, especially when the person is doing strenuous activities or hasn't had enough water. Symptoms of heat exhaustion include cool, moist skin, heavy sweating, dizziness, weak pulse, muscle cramps, nausea, headaches. To treat someone with heat exhaustion, get the person to a shaded area that's out of the sun. If there are no shaded areas available, keep the person covered by any available materials that can block sunlight. Give the person water and keep them hydrated. Place a cool cloth on their forehead to lower their body temperature. 4. Treating hypothermia. Hypothermia is caused by prolonged exposure to cold temperatures. It begins to occur when your body temperature drops below 95 degrees Fahrenheit. Symptoms of hypothermia include shivering, slurred speech or mumbling, weak pulse, weak coordination, confusion, red, cold skin, loss of consciousness. To treat hypothermia, be gentle with the afflicted person. Don't rub their body and don't move their body in too jarring of a way, this could trigger cardiac arrest. Move the person out of the cold, and remove any wet clothing. Cover the person with blankets and use heat packs. Don't apply heat directly to the skin because this could cause major skin damage. Give the person warm fluids. If you set the person on the ground, be aware that the ground may also be a cold source. Place warm materials on the ground that the person is going to lay on. 5. Treating burns. Before you apply treatment to burns, you need to identify the burn type and the severity of the burn. There are 4 kinds of burns. First-degree burn: only the outer layers of skin are burned. The skin is red and swollen, and looks similar to a sunburn. Second-degree burn: some of the inner layer of skin is burned. Look for blistering skin and swelling. This is usually a very painful type of burn. Third-degree burn: all of the inner layer of skin is burned. The wound has a whitish or blackened color. Some third-degree burns are so deep, there might not be any pain because the nerve endings are destroyed. Fourth-degree burn: a burn that has penetrated all tissues up to the tendons and bones. Additionally, there are 2 kinds of burn severities, a minor burn and a major burn. Minor burn: first-degree burns and mild second-degree burns. Major burn: moderate second-degree burns to fourth-degree burns. Minor burns don't usually need extensive treatment, but you could. Run cool water over the afflicted area, avoid icy or very cold water. Don't break any blisters. Apply moisturizer over the area, like aloe vera. Keep the burned person out of sunlight. Have the burned person take ibuprofen or acetaminophen for pain relief. Major burns are very serious injuries that require medical assistance. To help someone who has suffered from a major burn, do not apply ointments. Cover wound with loose materials to prevent contaminants from infecting it. Thank you for watching. Kindly subscribe to my channel.